Center for Communication Programs of Johns Hopkins University in Tanzania is implementing the Advanced Family Planning Project for about 10 years now, the objective of which is to advocate for increased funding, improve policy environment, and make family planning visible in socio-economic development efforts. And for this year, a year that will be marked by the efforts and the challenges we've faced as civil society organizations to address COVID-19, we've still managed to get a few wins, advocacy wins, I would say, and one of which that has come out of a lot of CSOs advocating with the government is to realize that the government of Tanzania has procured 90% of the contraceptive needs for this year. That means we are unlikely to face any kind of stock out. Again, the president also increased the amount of money or the budget for health commodities to 270 billion Tanzanian shillings in 2020-2021 from 35 billion Tanzanian shillings in 2015. All these are positive responses for the CSO advocacy work that is going on. For the Advanced Family Planning Project, I would just like to highlight one of our key successes. We've been engaging the Ministry of Health, and lately the training department has agreed to include adolescent sexual and reproductive health content in the nurse midwifery curriculum. And they've even started working on an addendum so that by 2022, when the curriculum is being revised officially, SRH content is in there. So we have been facing challenges as we address COVID-19, yet we have some encouraging outcomes and results that we can share with the world. The CSO community has been even more collaborative in doing advocacy, in doing service provision and so forth. And this document, the National Family Planning Costed Implementation Plan 2019-2023, lays out all the strategic priorities, and partners are aligned to implement this. So we intend to document the lessons that we've learned in trying to advocate for a method that is not easily accepted by government leadership, but we are not giving up as advocates. And we know, and what we've learned over this year is that CSOs, when we stay on course, when we package our ask with sufficient evidence, we are better off in terms of moving family planning forward. And I am quite optimistic as we also work with the mass media. We've managed to actually hit the airwaves with a lot of messages around why it is important to invest in family planning. And we hope and keep working on that. We hope and will keep working on this agenda as the new government takes over in November this year after the general elections on October 28th.